We, Dying with Dignity Victoria, heard the news last week about a hospice in Mansfield, beautiful Mansfield at the foot of the mountains in country Victoria. And this hospice is supporting individuals and their loved ones as they traverse the voluntary assisted dying path. Rosehaven is a 5-bedroom hospice located in 4.5 acres of what sounds like absolutely serene and incredible gardens, tranquil, peaceful, really the perfect place to end your life, being in amongst nature. It has now got 17 trained volunteers who've been trained in the process of voluntary assisted dying. And we are just in awe of this. If we had been told to describe the perfect model of voluntary assisted dying care, which people may choose for themselves, I think this would definitely be it. Some of the jobs the volunteers do are driving people to appointments, helping with the witnessing, the written component of the voluntary assisted dying process, and of course, just being with people at the end of life and those last few moments. And also supporting, which is so important, supporting the families and the loved ones, not only before death, at the time of death, but after death. I'm just so excited and proud to be able to introduce you to Bianca Hurle, who is the manager, the CEO of Rosehaven. And I know we've had so many questions from all our supporters and people all around Victoria, Australia, and even overseas, Ireland. And I'd just like to, first of all, thank Bianca for talking to us. And secondly, to ask you, Bianca, what motivated you to start
Thank
this
you.
incredible program?
Thank you for having me on, Jane. Thank you for the interview. And no, I'm just Rosehaven manager, not CEO.
Oh,
So I have worked in the health industry since the age of 17 in several different roles, so including in hospitals and as a regional assessment officer, and have seen people and the suffering that goes on with people. And when the VAD legislation came through, it was actually I felt very much as it was close to my heart, is that I have been drawn towards palliative care all of my working life, really, and wanted good end of life outcomes. And sometimes as a nurse, you see that there's not such good end of care outcomes. And I was fortunate enough to become a part of the Rosehaven team here in Mansfield and to take Rosehaven on. So we support people here at Rosehaven in all choices around end of life, and people from all walks of life. Everybody's welcome here, and there's no judgment. And if people choose that they want to die in hospital, or they want to die in their home, or they want to die with us, then we'll support them as best as we can, getting that quality end of life outcomes. And you're quite right with that, Jane, is that we see too often the people that are left behind don't receive the support that's really required. And so with going down the VAD space and having the voluntary assisted dying volunteers, is that we were hearing that people were accessing their medications in caravans or motels, and it just broke my heart. And so when the Hume region VAD navigator came across and did the education with the volunteers, it really did hit home. And I went, well, we've got this beautiful facility here. Why can't we offer it to people? And they can come. And if they would like to celebrate their life, the last night that they're in this world, if they wanted to come and have beautiful dinner or a picnic in the gardens, or however that looks for that person. And we were really fortunate to have received some funding through the Harry and Clef Friday Foundation, where we've been able to purchase a procedure chair that we can actually take out into the gardens, and so people can be there, they can be with their families, they can be with nature, they can be listening to the birds, they can have their animals with them. If they want their donkey or their horse or their dog or their cat, everybody is welcome. So yeah, we're really proud of the model of care that we offer here at Rosehaven, and we certainly couldn't be doing it without our team of volunteers providing such amazing support to them. One of the things that we did here was the hurdles that people are coming across, particularly in small communities where they want to find out more about the VAD process, but because of the fear of the judgment, that they may not want to have those conversations with friends and families until they've found out more, or until they've gone through that 3-step process and been accepted, and then start having those conversations. And so we thought, how can we support these people that are going through this process that's so stringent to them? Not only is it hard for them in rural areas because we don't have enough rural GPs that are VAD registered, but it means they have to travel distances, and sometimes they're not able to get to the appointments without telling somebody because they need the transport. And so our beautiful team of 17 volunteers said, well, we can provide that transport, and we can provide that witnessing of documentation, and we can support the people. And so from the Hume Region VAD Navigators conversation coming over and letting us know the ins and outs and educating us on VAD, it really did develop it organically. Like, it just felt as though that's something that Rosehaven needed to support and be a part of.
Oh, look, Bianca, as I said, it just all leaves me speechless. I'm absolutely almost intrigued as to how you've managed to find and sort of accommodate all those little fine details in your program, the little tiny details of VAD that no one would ever be aware of unless you've actually traversed, the journey with a loved one. How did you become so aware of all the little ins and outs
Well,
of the
it
process?
actually started with one of our guests who we supported. I got a phone call during COVID of a gentleman who was diagnosed with bowel cancer, and his wife actually had a rare form of Parkinson's, and he said, I don't want her to go into an aged care facility, and I only need support for one day a fortnight. And we ended up it was beautiful, actually. So this lady would come to us at 8 o'clock in the morning. We'd have breakfast together, and then she'd have a massage, and then because we've got a volunteer who comes in and does massage, and then she'd go across to our Friends of Rosehaven morning tea, where the volunteers come in and all have a bit of a social get together. They all bring something to share. She'd be a part of that. Then we'd have some lunch, and then she would be tired, and so she'd go off to bed for a rest. And we'd make sure that we had our Better Homes and Gardens here. And we ended up actually providing transport to the husband over to his chemotherapy in Wangaratta by one of our volunteers with the volunteer transport. And it was through this 6 weeks of providing that transport and that building that relationship was that this guest started speaking about that she was going through the VAD process, and would ask questions. And so with asking questions, if we didn't know, we would actually find out. And through that process, and then on the day that this lady actually accessed her medications, I got a phone call 2 hours afterwards from the husband and said that she had actually taken her medication and how beautiful it was. She was sitting out on her deck, and she was out there with the cows, and how beautiful it was. And so that really started Rosehaven's inquisitiveness into voluntary assisted dying. So completely different conversations that I found I was having with the husband in regards to it wasn't so much sorry for your loss, but how courageous and how beautiful that you could
Yeah.
respect your wife's wishes. And so completely different conversations. And so that started the spark. And then we looked into, I had a few conversations with Jo Hymas from VAD, and she said, I'd love to come over and provide you with some education. And so that sort of started the journey for Rosehaven and being able to support the people.
Oh, look, it's just incredible. Um, I think you are just a shining example to so many hospices and healthcare facilities around Australia and around the world. I think, as you know, one of our major problems and what we find so distressing is when we see cases of institutional conscientious objection, and where people are in nursing homes, aged care facilities, which they regard as their homes, and then
Yes,
are
totally.
denied the chance to actually die in their own home and are sent out to other places, as you say. Often it might be done covertly somewhere. Often they end up in big public hospitals, sterile environments. I mean, some people do like to die in hospitals, and it's once again, it's all about choice. But to be afforded such an incredible choice like this is amazing. We can just only hope that we'll see more of this everywhere. And I'd just like to know, have you actually been contacted by any other places yet about your program? Other people looking? Well, I think the time will be coming very soon. But listen, Bianca,
But Jane, I really just hope that people are able to share that we're here, and so that people who do want those quality end of life outcomes can actually come to us, because people don't know what they don't know. And so if we can spread the word and let people know that they can get that sort of support, and I'd love to see little Rosehavens pop up everywhere. So,
oh,
and I'm more than happy to support people and chat to people and share Rosehaven and Rosehaven's model of care with people.
well, I think that's fantastic. I can actually envisage a convoy of ambulances and cars on the road now. And if you've got 4.5 acres, you could probably put in a helipad.
Yes, well, we've actually talked about that one too.
Anyway, look, thank you for your time. And obviously, we're going to be talking a lot more and hearing a lot more, and just absolutely an admiration of you and this, all the volunteers, especially the 17 VAD volunteers. And we definitely keep in touch and want to keep up to date with everything you're doing. Well done, Bianca. Thank
Wonderful,
you.
Jane. Thank you.